All right, good afternoon, Mr. Harris. How are you?
I'm blessed. How are you doing today?
I'm fine, thanks. It looks like you have bicipital tendonitis of your right shoulder.
Yes, ma'am.
Okay. So today I'm going to be instructing you on how to perform an ice massage to help with the tendonitis. So basically, you have a tendon that runs right in this area, and with the tendonitis, it can get inflamed and it can cause pain, with the activity. So the purpose of the ice massage is to help with decreasing inflammation, as well as decreasing pain and increasing range of motion in that area. Okay, so we're going to get started. Before we do, basically, you need to have your arm like externally rotated in order to access that tendon or the affected area. Okay. So with the ice massage, you can just use, ice from the ice tray. Just use a towel, but you want the ice directly on your skin.
Direct on the skin. All right.
So before we get started, I'm going to go over some contraindications that might prevent you from being able to do cold therapy, okay? Okay. That you know of, have you been diagnosed with Raynaud's disease?
No, I haven't.
Okay, so basically that's a disease that if you're exposed to cold, it can start to mess with your circulation in your extremities. Okay. Also, do you have any cold allergies that you know of, like
cold allergies?
Yes, like
No.
hives.
No.
Okay. No, like gangrene or death of your tissue, like skin tissues with cold when you're experiencing cold.
No, ma'am.
Okay. Any circulatory issues?
No, ma'am.
Hypertension?
No, ma'am.
Okay. Any sensory deficits? So are you able to feel hot and cold on your body pretty well?
Yes, I am. Yes,
okay.
Yeah.
And then, have you noticed at all that you've ever had like blood in your urine after being, experiencing cold?
No, ma'am.
Okay.
No.
And then lastly, do you have any lotions or topical, like analgesic or like Bengay or any topical pain agents on your skin?
No, ma'am. No.
Okay. So at home, you want to prevent from obviously having like using icy hot or any of those things because they can cause like cold burns.
Oh wow! Never do
to
that.
your skin.
Never do that.
So all right. So we're going to get started. There's about 4 different things that you may feel during the process. They're all you're supposed to feel them.
Okay.
So initially you're going to feel cold. Then you may feel an ache, burn. You might feel that at the same time. And then ultimately you'll feel numbness. Okay? So we'll get started. You may want to gently give the ice a rub prior to putting it on the affected areas just so you can kind of smooth out any rough edges. Okay, ready?
Yes, ma'am.
All right. So when doing the ice massage, you want to use small, either circular or like linear strokes. And you want to stay within the desired, like the affected area. You don't want to go out of that area because the whole point is that you want to build up to the numbness, because the numbness is what helps with the inflammation, the pain, and things like that.
Yes, ma'am.
Okay.
So exactly how long do I supposed to apply ice to the skin?
So ice massage, you can apply for up to 5 to 10 minutes or until you reach numbness. Typically, everybody is different, but typically people will reach numbness either before that or within that 10 minutes.
And how many times a day should I do it?
Okay, so you can do it, multiple times throughout the day, but kind of similar how you do with ice packs with the 20 minutes on, 20 minutes off. You don't want to, you wouldn't want to be doing it. I would wait 20 minutes, at least 20 minutes before I reapply. How are you feeling right now?
I think I'm starting to feel the numbness.
You're starting to feel the numbness?
Yes,
have you gone through the pain and the ache and the burn?
Yes, ma'am. At the same time.
Okay. All right, so I'll stop. Do you feel that?
No.
Okay. Okay, so that means that you did, you did reach true numbness with the ache and the burn at home. If you have somebody else doing it, or especially if you're doing it with yourself, it's very important to push through that ache and burn because you have to get through that to get to the numbness. So, afterwards, you should see, like, if you see red, that's a normal response. It's just the increase in histamine production. That's normal. What you don't want to see is like white splotchy, because that could be an indication of a cold burn.
Wow.
Okay. So we'll dab you off, and then also with any like stretching or strengthening exercises that you may be doing, you may want to do those before you ice. Otherwise, if you do them after, you might want to allow yourself about 10 or 15 minutes after you ice, because the ice is really good for injury, but at times it can kind of decrease, like temporarily decrease elasticity. So you don't want to like try to stretch immediately after icing.
Okay.
You know how heat elongates our tissues, but the ice can temporarily, until your body tissues cool back down, it might not give you like a true, stretch.
Yeah.
Okay. Do you have any questions?
Not at the moment. I do not. No.
Okay. All right. Well, thank you.
Thank you, ma'am. Thank you.
You're welcome.